Since the pandemic's arrival, COVID facilitated the need for syringe service programs and community groups to find better way to meet people where they are. This video will chronicle how various organizations from local health departments to healthcare providers and community-based organizations all adapted their outreach to reach an increasingly vulnerable population. Meet some of Maryland's frontline workers poised to tackle the opioid crisis head-on. Hear them talk initially about what was happening as COVID started to take hold of the state.
When COVID hit, it was chaos at first.
It really changed the dynamic of what we were able to do.
Of course, there was a lot of fear, a lot of uncertainty.
The program was put at a standstill due to the coronavirus outbreak.
Yet with all the fear and confusion, COVID's presence didn't bring about decreased use. It had quite the opposite effect.
We did not hear people too afraid to access services. We heard people really afraid because the services they wanted to access were no longer available.
Believe it or not, our numbers actually have went through the roof.
As the pandemic progressed, each organization found a way to adapt to the changes, ensuring services could resume safely for both the staff and the participants.
Because of the pandemic, we have had individuals talk about relapse. We've also had individuals talk about changes in the substances that they're using. So unfortunately, those changes have had a negative impact on a lot of individuals. That has actually opened up conversations because as they're willing to share this information with us, it allows us additional opportunity to provide education.
Let's take a closer look at Washington County's Health Department, a fixed model method that provides services based out of a single brick-and-mortar location. They allow participants to call in the order. Once completed, the order is packaged and carted outside for pickup.
We've seen an uptick dramatically in the amount of encounters that we're having from people.
It seems like COVID has hit. We've actually got a lot more participants. I don't know if it's because they don't have the stigma of having to come into the office. Because before COVID, usually they would just come in and then package what they needed themselves. But now that we are packaging it for them, it seems like we are getting out a lot more supplies and to newer participants.
In Baltimore City, Baltimore Safe Haven takes a more holistic route to addressing the needs of trans youth and others in the community. They combine an effective mix of fixed location with mobile outreach practices.
Well, Baltimore Safe Haven was founded by me. I was a survival sex worker. So in the community, I noticed that we had a lack of resources coming from everywhere that was in Baltimore City. It was historically behind more than other cities. So I designed a program that was designed around our needs as Black trans people. In our first year, and we started November 18, 2018, we serviced almost, I think it was 756 clients.
Baltimore Safe Haven also runs a transitional home that still operates during COVID for trans youth. Here's more from the house manager.
For the transitional home part, is 18 to 24. So the first thing we do is the intake process. We make sure you have a negative COVID test. We keep hand sanitizer, make sure you wash your hands fluently. We prep your meals when you're in the 1824 here and you live in the transitional home. We have a whole GED program that we started. And we just let them know education is important. Even through COVID, you can do anything.
Anything that we provide on the inside, we now bring it outside. We now have the precautions to which we keep ourselves and everyone else in the community protected while still doing our duty. We have to make sure we get it right every time, the first time.
Just a few blocks away from Baltimore Safe Haven, the Baltimore Harm Reduction Coalition, also known as BHRC, shows how despite COVID, they're able to prepare and distribute safe injections and smoking kits to the community.
I will usually, mask on, gloves on, hand sanitizer in the car, always, 100% of the time, extra masks, extra everything. I will usually get out of the front seat and kind of walk around to the passenger side front seat, and that's where a volunteer will be sitting. That's sort of like the reverse drive-through window. I can talk to each person, at least for a second, and be like, so here are the things that we offer. Do you need all of them? Everyone can have everything. Like no one, it's low barrier. Like no one has to prove anything. We don't ask for, IDs or anything like that. And so I'm able to sort of assess what folks need. If they really don't need a safer injection kit, I don't put it in the bag because that would be better used for somebody else. Talk to people about anything, about their struggles, about their joys, just whatever. Just let them know that they are seen and that we are doing work for them.
Just down 295 South is Prince George's County's Syringe Service Program, a community-based organization based out of Seat Pleasant, Maryland. Mark Robinson, one of the founding employees, speaks about how the backpack model allowed them to build relationships and trust within the community and how it paid off during the pandemic.
People who use drugs and people who inject drugs generally are not the people that are going to come to a brick and mortar establishment. So it's a better strategy if you're really sincere about helping people to go in to those communities where they are and build those relationships and provide the service. And that's why the backpack model makes sense. Generally, outreach is up close and personal. But now we have to operate with a model that is socially distanced. And it seems a little impersonal and a little different to see somebody with a mask on and a shield and that kind of thing. But yet, because of the trust and the consistency and the credibility that we have in the community, because we've already been there and we've engaged with people and people know us and trust us, that wasn't a barrier.
We kind of like get out the car with masks on. We have some houses that we go to. We go to the door, knock on the door, use our masks. People may come out, make sure they have masks. If they don't have masks, we'll give you a mask, and they make an exchange that way as well. Or if we do go into the community, we can pull up in our vehicle, and we have like a grabber. We can put the bag to it. We can stick the bags out the window with a grabber. You can grab and just move on.
Frederick County's health department blends all of the models together to provide harm reduction services to as many people as possible.
So one of the things that the pandemic has allowed us to do is increase our service delivery models. We're doing a lot more street-based outreach. We've begun offering delivery services. So we use our peer recovery specialists to make deliveries to individuals in the community. And that can mean, meeting someone at a identified location, and actually getting out and interacting with them and talking with them. It can mean knocking on someone's door. It also has meant prearranging for someone to pop their trunk prior to us getting there and giving us the vehicle description and the license plate and discreetly putting those items and supplies in that trunk, securing it shut, and then that person confirming with us that they in fact did get the supplies and have received the supplies. The nice part about that is it has truly allowed an individual to remain completely anonymous through the process of seeking services.
Frederick County has also partnered with a local substance abuse treatment center.
Especially now during COVID times, it's really difficult to grasp onto different parts of the community that can help you. The partnership in between the Frederick County Health Department and Concerted Care Group has been such an immense help for our community through these difficult barriers.
We experience a lot of gratitude from our participants, but I think that has even increased more so during COVID. So the pandemic, I think, has even increased the appreciation people have, because while everything else has closed down, we have still been there.
Next, we'll see how University of Maryland's Addiction Treatment Center on Baltimore's West Side provides holistic services to their patients.
When COVID hit, the Baltimore Harm Reduction Program asked us to be a conduit for them, where they would give us needles that we could hand to our patients. So we had started to get involved in doing that, and we're continuing to do that, which I think is a great service for our patients. Clearly, patients are worried about COVID and how that might impact their ability to stay in treatment.
To illustrate how University of Maryland implements their social distancing, go no further than the entrance, where patients' temperature is taken, after which they're escorted to an intake room with video capability.
And so that way patients could still come in, still engage in sort of their social distancing, if you will, but still correspond with the physicians, the interpreters, all the regular individuals that they would need. And so we sort of integrated that into our care as well, community-based, community-driven primary care and harm reduction programs into the setting of a methadone/MAT program.
But don't just listen to us. We wanted you to hear from participants on the importance of syringe service programs.
When COVID hit, I wouldn't say I was afraid to access the services. More or less, I was just kind of worried about how the interaction would have been with the people.
It stays between you and them, and they're here to help us, not cause any problems.
Yeah, everybody wears masks, they socially distance themselves and, make sure that all of that's safe, but, they're still doing what they can to help people.
And no matter where we are, they're there. It's not only just the syringes, wound care, kits, and of all things Narcan, and I cannot tell you how many times that saved lives. And I mean, I have never, ever, you know, been involved with any kind of services, you know, that has been so helpful.
You know, we know these services are preventing the spread of infectious disease, and we also know that these services are saving lives. I would encourage anybody that either doesn't have a program in their community to reach out to the Maryland Department of Health and find out how they can bring these services. You know, the bottom line is everyone needs to be treated with dignity and respect, and that includes people who use drugs.